sometimes it happens that, as normal human beings, the symptoms of allergy, something which is overlooked.
All we do for an allergy is pop in a pill and just learn to live with it.
What is triggering, which season, what food, that itself is makes sense. We can avoid that.
Diagnosing early is the key so that it does not worsen, it does not progress to a much severe form of disease for that.
Choose your tests wisely. Always consult an allergy specialist.
Undiagnosed allergies are actually the main cause for further worsening of symptoms.
Hello everyone, welcome to the Allergy Insight Show, where we talk everything which is allergy related. So whether you're dealing with seasonal sniffles, some food sensitivities, or chronic allergic condition, we are here to have some expert advice, some practical tips and latest research. Join us as we explore the science behind these allergies, share some personal stories and offer you solutions to help you live your best allergy-free life. I'm Tanvi Mehta and I'd like to welcome Dr. Kashyapi, Dr. Somshekhara and Dr. Soumya and thank them for taking out the time to discuss about this. So starting off, as a person who has faced this firsthand in her household, so be it my husband when we moved to Bangalore a decade back, there was this uncountable bouts of sneezing, like 20 sneezes in a minute, which would be highly irritating for me. And of course, irritating for him too. So we figured out lately after doing some tests that it's because of some pollen, which we found very weird. Then, half a decade later, when I had my daughter, I would see her having cold-like symptoms when it was fully warm and summer outside. So I really couldn't tie up and I just felt somewhere that it could be because of some allergy, but I was clueless about it. So I really would want to have, your perspective, which could help me clear some of my doubts and of course doubts for many people there to better understand, what is going on because, it's unexplained and this issue is prevalent more than we realize. So starting with Dr. Kashyapi, I'd want to understand that, when you know that you have an allergy, so when should we start, consulting? And a basic question like, whom should we consult? Which doctor should we?
I would agree with your, point of allergies being there for a very long time. Awareness is something which is being created recently for the past couple of years, I would say. Yes, we have a lot of doctors. There's no scarcity for doctors all along, but allergy is something which should be consulted from a specialist. Yes, we do have allergy specialists who are trained in allergy, especially we have pediatricians who are trained, we have pulmonologists, we have general physicians, we have ENT surgeons who are trained in allergy. They would be the better persons that you would want to approach with regards to getting any allergy tested.
Okay, that makes sense. So coming to Dr. Somshekhara, I'd want to understand that, are these allergies hereditary? Like, can we tie things up like that?
That is a good question because majority of them ask us whether this runs in the family.
Yeah.
Is it hereditary? It's true.
Okay.
If one of the parent is affected, 50% of chance they have been affected.
Okay.
So it runs in the family.
Okay.
It is called as a hereditary.
Okay.
But
So-
it is not that all the hereditary.
Okay.
Sometimes environment also triggers.
Okay.
Her hereditary may be augmented or flared up by environment.
Of course.
So both are interlinked.
Agree. And in the environment which we are living on with pollution everywhere,
Yes.
I think it's more than it's ever been.
Yes, both allergens
So-
either in the indoor or outdoor.
Allergens are everywhere.
Yeah, yes.
Totally.
It is influencing.
Totally.
Yeah.
So, like, Dr. Soumya, if you could, help us answer that, can we test family members for any hidden allergies? Like, can we do a test for the entire family and see if they have something which is underlying?
I think it's a very common question we get as pediatricians when one of the elder siblings has had an allergic rhinitis or asthma. The mother is worried that could my next offspring would be having any allergies and can I anyway know that will this child be at risk of allergies. Sometimes if there is a high risk child who has had multiple hospitalizations or quite severe episodes, I think in certain high risk families it may be worthwhile looking at for the if the child is having any allergies and keep the child under close follow up. It could be environmental allergies or food allergies also. In certain subset, I think, yes, we can test for these highly risk families and keep them under close follow-up.
Okay. That helps. So, we might be knowing that there are some common symptoms of allergy, like, usual everyday allergies like sneezing, or there's a tummy upset, or something like a skin condition which is flared up. But scientifically speaking, going behind it, can we actually pinpoint what is the cause of that allergy? What's triggering it? Like, how do we do it? If Dr. Kashyap, you could help
Again,
me understand.
every science actually evolves from major day-to-day experience that we face, a day-to-day activity that we face. So definitely all the symptoms are something that we face on a day-to-day life. Just for example, a very small neonate or a toddler having multiple episodes of loose motions or multiple episodes of cold or sneezing does not just point to either only food allergy or dust allergy. It can be both. And the same way, a child or an adult having one allergy at one point of time is not prone to have only that allergy for the rest of the life. They may have multiple allergies at a later point of life too. So the pinpointers will definitely be for allergy, especially what the person is actually suffering for. Say, for example, you have been suffering from multiple things for a certain point of time in different phases of your life. That is just a clue that you may be suffering from allergies. It may be temporary, but it may be multiple times that you are facing it. So that is a clue that you may be suffering from allergies, and it's just a cue that you will have to consult an allergy specialist for that.
Okay. So once when I've got the cue that, something is not right and there could be something which is triggering and I need to correct it. Now I have taken the decision to take an action. So where do I get myself checked?
Our answer for that would definitely be an allergy specialist, because we are focusing, it's all about allergy right now. The discussion is all about allergy.
Yeah.
Yes, all the general physicians, all the doctors, all the family physicians that you would consider are aware of allergies, but an allergy specialist would be aware in depth of whatever allergy. So the specialist would actually be able to tell you if you have to avoid a certain food, if you not have to avoid a certain food, especially in case of pediatrics for that matter, in case of children for that matter.
Okay.
So allergy specialist would definitely be an apt person where you can go get your allergies tested, be it a skin prick test or be it a blood workup or anything for that matter. Allergy specialist would be an apt person.
Question for you, Dr. Soumya. If there is any disease which is an underlying disease, maybe a smaller one, or can it interfere with the allergy testing? Like, can it be that one of the factors which could skew the test result?
A very good question, because as in practicing the allergy specialist, when we get patients who are keen for an allergy testing, I think it's important to know a little which conditions may interfere with the testing. Some skin conditions such as eczema, where the red and inflamed skin itself can cause high sensitivity and especially may interfere with the skin prick test, as well as other diseases such as dermographism, which has a very sensitive skin individual, where even on pressure the small lines come up on the testing, as well as patients who has acute infections. These are the few things which may interfere, as well as it's important that we ask the patients if there are any anti-allergic medicines which may interfere with the test, because they wouldn't know what could be interfering with the testing. So it's always important to make sure that they are not on these anti-allergic medicines. And in these conditions where we may not be able to do a skin prick test, I think it may be imperative for us to ask for a equivalent blood test, which may save the time of the patients. So choose your test wisely. Always consult an allergy specialist rather than just going by self and getting tested on a whole blanket of RF test in the labs, which is very common when we see in our day-to-day practice.
Okay, so yeah, that's actually a great thought, that even if you've taken the decision to get yourself tested and that kind of awareness has come, that awareness should come up from a place that you do your homework well and test the authenticity of the place and the test and the quality of the test before proceeding. Thank you. Dr. Somshekhar, if I may ask you, that pregnancy is a phase in women's life where, she is having so many things going on, and, the concerns are double. So if there are any pregnancy-induced allergies, how do we get it done? Like, how do we test it? Is it safe during that time?
And it's very sensitive question, as well as it's itself, pregnancy itself is a sensitive period. If you ask me, so many allergies will be dormant during that. It will not be active. But some allergies, they'll become flare up during this pregnancy, because their pregnancy, this altered immune system will be there, which is needed for the pregnant woman. It is managed in such a way that she is fit for that. But and when it comes to allergies, some may flare up or some may become dormant. So depending on the allergen and the environment, makes sense.
So coming back to Dr. Soumya, when you said about, medication, could maybe trigger allergies, I'd want to say, like, if a person is having a medication, maybe on a temporary basis without even realizing, popping up pills today is such a common thing. So are there any do's and don'ts? Like, can medication affect the results? Can it give anything which is not indicated?
Certain medications such as anti-allergic medicines, many a time, sometimes it is common to use over-the-counter drugs to allay their symptoms. So we have to be bearing in mind what group of medications they are, and those things may interfere with the skin prick test or a blood test. But certain group of drugs where there is a lot of phobia regarding steroids, yeah, because they are the mainstay of treatment, especially in a chronic symptoms. Topical, that is local nasal sprays or inhalers, which we use for asthma, they usually wouldn't interfere with the allergy testing. But the oral medications, which may be steroids if taken for a long period of time, that may affect the authenticity of the skin prick test or the blood test. So, and sometimes I think in our practice, we very commonly see alternative medicines which are quite good, but we may not know the contents of those medications, such as homeopathy medicines or Ayurveda medicines. Sometimes we have seen those medications also can affect the results of the
Okay.
skin prick test or the blood test.
Okay.
So always, again, before we embark on the testing, it's important for us to make sure the checklist to be ticked off, which are the medications may or may not interfere, and then go ahead for the allergy test, be it a skin prick test or a blood test.
So, coming up to Dr. Somshekhar, since we've already talked so much about, where to take the allergy test, what are the preconditions of allergy test, I'd want to ask the next level that after we have taken that test, what is the benefit I'd immediately see? Like, what are the benefits after doing an allergy test, if you could just simply say that?
See, before answering to allergy test and their benefits, let me understand, like, we should maintain the diary. That itself is a good test. Okay,
Agree.
we should know what is triggering, which season, what food. That itself is makes a sense. We can avoid that. Apart from that, if it's persisting with lot of flare-ups, severity, based on that we have allergy test. How it helps? It helps in making its own allergy chart. March, how it progresses.
Okay.
Definitely, if you know the allergen, you can avoid that particular substance. That may be a mild or a severe one. Definitely,
Yeah.
it helps in the severity.
Yes, yes.
And as
yes.
well as very important is we can tackle with the medications.
Of
The
course.
specific medication we can use. Like in the long term, here we do have medications that can be monitored by this kind of allergen
Yes.
and detection.
So true. I think after self-awareness and after getting the test done, simply logging in and being conscious about what is triggering what,
yes.
I think half of the battle is won
Yes,
there.
yes, yes.
And then you'd have definitely
Yes.
the value of medication
Yes.
on your side to.
And one more
have the
answer,
benefit.
like, this can be done, but when it comes to pregnancy, we can't do all these tests. We do have some blood test. So relatively, we'll come to know about that.
Okay.
But these, that specific sensitive test, we can do in normal children.
Okay. Okay, great. So, Dr. Kashyap, I want to ask you that sometimes it happens that, as normal human beings, the symptoms of allergy, something which is overlooked by many, and they just say, like the Indian mentality, just leave it and just move on with your life. And people learn to live with. But I want to ask you on the serious side that what happens if it gets undiagnosed? And what are the repercussions of not paying attention to those symptoms? Like, what if the allergy is undiagnosed? What happens to that person? What could happen to that person?
We are now in a post-COVID era. We know COVID has been a pandemic.
Yes.
But allergy is something which is termed as a epidemic, to be very frank. It is a very undiagnosed epidemic that's been there with us for decades now.
Yes.
As you rightly said, all we do for an allergy is pop in a pill and just learn to live with it. Yes, that helps in only very less percentage of people, but what generally happens is undiagnosed allergies are actually the main cause for further worsening of symptoms. Say, for example, a child is having multiple episodes of cold when he was in school, in preschool, and all that age. The very same child would probably end up having a severe wheeze a couple of years later, say 5 to 10 years down the lane. It will probably end up into wheezing. All we know is wheezing is different, allergy is different, cold is different. Unfortunately, if you see 90% of asthma patients all over the world, if you see, would have had some sort of an allergy earlier in their life. So diagnosing early is the key so that it does not worsen, it does not progress to a much severe form of disease for that matter. So the faster you try to diagnose allergies and keep a check, as Dr. Sir has told very rightly, maintain a diary, see what is triggering you. That would probably give you a hope in future to just tackle it at the bud and nip it at that stage.
Yes, completely makes sense. That is actually very insightful. So, Dr. Soumya, coming to you. Suppose I've taken that allergy test and I've got my results, and I'm in a path of controlling it and being aware of it and being conscious about it. Now, how frequently should I take the test? Like, is it like any other health test, like a blood work or a full body checkup? What is the frequency of getting these tests done?
Very apt question in the present scenario. I think where anybody could walk into any lab and just get whatever test done. But allergies, it may not be very frequent, but depends on patient to patient again. Like in children, we deal with food allergies. Contrary to the belief that Indians do not have much food allergies, we do see our share of food allergies. And over a period of time, children can overgrow certain food allergies or acquire newer allergies. So in that perspective, it may be important to know which they have outgrown, like milk and egg allergies can be outgrown. For example, nut allergies, they do tend to persist for life. Or if the patient has had a worsening of symptoms or has developed new symptoms, say when somebody has moved from one city to another, where Bangalore, I think we see a lot of moving population, it's quite important that we know a patient was well controlled in another part of the city but has developed newer symptoms. It's worthwhile to know what newer allergies the patient may have developed, or the patient is on therapy like immunotherapy, where we deal for building tolerance to what one person is allergic to. So in the modality, how the patient is doing well, or we may have got this test a while back and which may not be quite relevant today. I think with the advance of technology in the healthcare facility, even the advances in the diagnostic testing also has improved. I think it's important to take the patient into consideration and aptly repeat allergy test whenever required.
Totally makes sense in the changing environment and the pollution's level doubling by a minute. I think more allergens are there in your environment, which is really alarming. So, yep. You're correct. So, listening to all of this, I feel that I've actually gained so much insights about allergies and allergens and how to tackle it. And I think the first precedent of understanding that you have this is a symptom. Now, I ask you, Dr. Somshekhara, that have you seen any cases? Is it possible that you have absolutely no symptoms at all, but you have an underlying allergy which you're not aware of?
See, what happens, you may, if we just mentioned about so many tests.
Yes.
Right? Test may be positive, but patient might have any symptoms, be symptom free.
Exactly.
Or maybe got severe symptoms, but test may come negative.
Yes.
It do happen.
Yes. Okay.
But for this, that's why our history is important, our examination is important, what are the triggers are important. But if you take our overall scenario, especially in Asian countries, few are they'll not be sensitive over a period of, they'll become sensitive, then once again they'll become desensitized themselves, natural course. It do happen. So many hidden allergens will be there. Like majority, if you heard in our elders at home, is sensitive to milk, He's sensitive to egg, they say.
Agree.
But over a period of time, with or without test, they'll just outgrow the diseases.
True.
It do happen.
Okay.
So it's a vice versa. See, it's a comprehensive collection of symptoms, symptom diary, examination, then allergen test. Everything makes a sense to come to the conclusion.
Yes, the holistic
Yes,
picture
yes.
of which life stage you are in,
Yes,
which environment
yes.
you are in, any underlying health
Yes.
condition, any medication. There are so many factors which
yes.
could actually trigger or maybe mute
Yes,
an allergy.
yes, yes.
So, yep, that is definitely very, very insightful. So, as we realize that we have gained so much immense knowledge about allergy, which is actually present in so many of us, and I hope that in a life stage where you are in, and if you have any underlying questions or doubts, our doctors would have cleared it. Thank you for tuning in to the Allergy Insight Show. We hope you have gained valuable knowledge and practical insights to handle your allergies more effectively. Parents, don't let allergies hinder your child's well-being and happiness. Ensure that you timely visit an allergist and have an accurate diagnosis for an effective treatment, that your child can thrive without any allergy-related limitation.